Okay, so I'm back with a little more information, I guess, for my heart stuff. So, as you guys know, I'm going to be having surgery the 24th. Um, Recovering after surgery in the hospital. After surgery, I'll spend at least a day in the intensive care unit. Highly trained nurses will monitor me closely. When I'm ready, I'll be moved to general care room. I'll stay there for 5 to 6 days. While there, I'll recover further until I'm ready to go home. Recovering after surgery at home. You've just come through one of the major events of your life. So give yourself time to get better little by little. Expect good days and bad days. At first, you may tire easily, but being active will help you recover. Find the right balance between rest and activity and follow all instructions you're given. So, risk and possible complications of heart valve surgery. Most valve surgeries have an excellent outcome, but any major surgery carries risks. Valve surgery's risks include bleeding or the need for a transfusion, infection, blood clot in the legs, in the valve or elsewhere, heart rhythm problems, stroke, heart attack, or death, problems in the lungs or kidneys, failure of the new or repaired valve, damage to the heart. So when to call your doctor. During your recovery, call your doctor if you are short of breath while resting or after only a little exertion. Notice your heart beating fast or slow or skipping beats. Gain more than 2 pounds in one day or 5 pounds in 7 days. Or your legs swell. Feel dizzy, have nausea or vomiting, have a fever of 100 Fahrenheit or higher. Notice changes in your incision, such as swelling, oozing, foul odor, or getting red or tender. Have pain in your chest or shoulder that gets worse instead of better. Have clicking or grinding on your breastbone. So, goes on to heart valve problems. Your heart's job is to pump blood through your body. That job starts with pumping blood through the heart itself. Inside your heart, blood passes through a series of one-way gates or valves. If a valve doesn't work correctly, not enough blood moves forward. A problem heart may not open wide enough, not close tightly enough, or both. In any case, not enough blood is sent to the heart muscle or out of the body. So with mine, because it's the tricuspid valve, what happens is the valve doesn't close all the way. So I've got these masses there, but the valve also doesn't close. So instead of just going down, a little bit of blood goes back up. It has caused the valve to be bigger. So you can have a problem valve for decades, yet have no symptoms, which is what I was going through. I had no symptoms up until right before I went to see my cardiologist. I was having a little bit more chest pain than normal, but I wasn't too concerned about it. If you have symptoms, they may come on so slowly that you barely notice them. In other cases, those symptoms appear suddenly. So the common causes of valve problems, such as mine, it says people of any age can have a heart valve problem. You may have been born with a problem valve, or a valve may have worn out as you've aged. It may not be possible to pinpoint what caused your valve problem, but common causes include buildup of calcium or scar tissue on a valve, rheumatic fever, or certain other infections and diseases, which is one that they think happened to me, is they think it was a infection, high blood pressure, other heart problems such as coronary artery disease, and congenital defects of the heart valve. So one of the things I have, for example, is regurgitation, which is when the valve doesn't close tightly enough and the blood leaks back, which is unfortunate. But that's it for some of this paperwork, but they sent me home with a lot. So, because they sent me home with that. And then I also have this, which has the date of my surgery, where it is, some instructions, like I have to stop taking my Xarelto like a week beforehand. Brush my teeth 3 to 4 times a day, and bring a toothbrush so I can brush my continuing brushing teeth there. And then they're going to put me on a cardiac inpatient diet while I'm there, which is basically a diabetic diet. And then they have another whole book for pre-op. And then I have one about cardiac rehabilitation and eating for a healthy heart, which I might go over this one at some point here. So that's it for now.